Everybody, and welcome to the Heartfulness Wellness webinars. Today we have a quite an interesting topic: blood pressure in terms of stress and isolation. My name is Dr. Aravindhan Ravindran. I'm a diagnostic and interventional radiologist. I live here in the Greater Vancouver area, Canada, and we have our guest today, Dr. Chandra Koneru, who is a board certified specialist in internal medicine. And he has been in private practice since 1993. That's 27 years of experience serving the small town near Huntsville, Alabama. He serves as a chief of medical staff, and he's also the medical director at North Alabama Specialty Hospital in the USA. He's also a medical director at Heritage Assisted Living and Memory Care. He's on medical staff at Athens Limestone Hospital. I'm very pleased to have Dr. Koneru with us to address this important topic on stress, isolation, and blood pressure. Hi, Chandra. How are you?
Doing good, Arvind. Good to see you, Arvind. And thank you for having this opportunity to discuss about this important topic. And hello, everyone. So it's a we just had this hypertension day yesterday, blood pressure day yesterday, right? So yeah, and
so I've got a set of questions for you, Chandra. So I'm the guy who's going to be grilling you.
So it's like, for me, since you asked me to do this, I've been preparing like as if I am preparing for a board exam. Okay, you can evaluate at the end.
Well, that's we are fortunate then, because we'll get to know a lot about this, and I'm waiting to hear about more about this as well. So, like you mentioned, we recently had this World Hypertension Day, and my questions are simply like to begin with for us to understand what is blood pressure and why is this pertinent, particularly during these times. Can you help us understand that?
So that's a very, very interesting question for most of us. The blood pressure is the pressure exerted pressure from the flow of the blood on the blood vessel wall, right? So all of us have blood pressure. For us to have enough circulation to the rest of the body from the heart, there need to be enough pressure in the body. So when it goes to a certain level, we call it abnormal blood pressure, right? So so that's basically what it is. And you said what is blood pressure and why is it related to these present times? Why is it important? Blood pressure is a global problem. It has been very important healthcare issue for decades, and more importantly in the last few decades. And the prevalence of blood pressure, if you take 100 people in any society, about 40 to 45 of them have high blood pressure if they are above 25 years of age. Whether it is in the Western world, or even if you go to countries like China and India, there is a high prevalence of blood pressure in the community. So the managing this blood pressure, treating this disorder has major implications in one's health, and it affects the healthcare dollar spending, and also it can lead to some disability and loss of work for individual. So it can affect the individual at a health level, at his health, and also at his jobs, and able to function in the society as a productive individual.
Right.
So especially during these times, we are all under stress. This is a very unusual time, very challenging time, uncertain times. So when there is uncertainty in the air, people are not sure what is going to happen to their physical health, to their families, loved ones, and as a community and as a country, as a world, we are all not certain about this whole incident that we have been facing for the last 2 to 3 months. So that gives us emotional stress. This can lead to emotional stress, which in turn can affect the blood pressure. If people already have blood pressure, pressures can go up if they are stressed out from this disorder. Even if they don't have a blood pressure problem before, if they don't take care of themselves, blood pressure can go up. So there are some small, simple things that we can do in addition to seeing the doctors and getting the medical advice and taking the medications that we will discuss as we go along.
Okay, yeah. Well, thank you for highlighting the importance of it, and particularly the magnanimity of this, the magnitude of this problem. When you said that in adults about 25, the incidence of having this about 1 in 2 or 1 in 3 people have it is quite staggering, actually. So on that note, what are the parameters for normal blood pressure, and what are the parameters for abnormal blood pressure, and how do we monitor our blood pressure?
Right. So generally we say about 120 or 80 is the normal blood pressure, right? And then there is something called abnormal blood pressure, which is elevated blood pressure. We don't diagnose as hypertension in those patients. We say it is elevated. So that means these people are prone to develop high blood pressure over a period of time. And if they act and take care of themselves, do some preventive measures, they can prevent further progression of the disease. So elevated blood pressure is between 120 to 129 in the top number, which is a systolic number, and the bottom number has to be less than 80, right? And then this stage 1 is between 130 to 139 on the systolic, the top number, and between 80 to 89 in the diastolic, that is the lower number that we measure in the blood pressure. And stage 2 is 140 and over, and 90 and over. So when we talk about these two numbers, the top number, systolic blood pressure, is from pumping of the blood from the heart, and that's why the pressure is high. And when that is the top number, I should say. The bottom number is when you measure the blood pressure when the heart is relaxing to fill itself with the blood, to pump it again. Okay, and then there is something called hypertensive crisis, which is emergency, which is an emergency if the blood pressure is more than 180 over 120. So these are the broad categories, and we can talk more about it. There are certain things we can do as individuals from progressing from elevated blood pressures to stage 1 or 2.
Mm-hmm. Okay, the other portion is how do we monitor our blood pressure?
Right. So the second question is how do we, so before we say somebody has high blood pressure, we want to accurately measure the blood pressure. That is very, very important step, checking the blood pressure very accurately. Like you can see it on the slide, proper size of the blood pressure cuff is important, proper application of the blood pressure cuff is important, and sitting down for about 5 to 10 minutes and relaxing, being quiet. Just I advise my patients, sit down, relax, close the eyes, just feel the stillness within. Close the eyes and feel the stillness within. Breathe, take some slow deep breaths, let the blood pressure cuff apply. Apply the blood pressure cuff and apply it in proper way, and rest the arm. Avoid the coffee before you do it for at least for 30 minutes. Empty the bladder. Don't be in any discomfort. So physically relaxed, mentally relaxed, and then check your blood pressure. So and then the size of the cuff is very important. Somebody has a large arm, they have to use large size cuff. Right. So if once we measure the blood pressure properly, then and also we take at least 2 readings, 1 or 2 minutes apart, maybe 3. First reading can be high in some people, so we tell some of the patients to do the average of second and third readings. Just because somebody is checking our blood pressure can go up.
Mhm.
Okay.
So, well, thank you for covering those important points. So it's not necessarily if somebody has a high blood pressure as the first count. So we check the blood pressure again to make sure the trend is like that. So the important thing here is not to panic if somebody has, because we need to confirm that.
Right.
So what are the reasons for us to have abnormal blood pressure? What causes it?
So right. So when you look at the blood, hypertension, the abnormal blood pressure, basically there are two categories. The first one is what we call primary hypertension. The second one is secondary hypertension. The reason for primary hypertension, we don't know the exact reason for that, but there are certain risk factors. Like for example, age. As we grow older, blood pressure gets higher, especially above 60. And then the ethnicity, race, it's predominant in certain ethnicities. For example, African American community in this country. And then the obesity, overweight, lack of physical activity, family history, and then the associated problems like diabetes. Right. So all these things can contribute to blood pressure, but we don't know the exact mechanism of exact reason for blood pressure in primary hypertension. In secondary hypertension, it is related to certain underlying medical problem. For example, people can have a blocked artery to the kidney, and then the blood pressure can go up. They can have too much of cortisol in the body. They can have too much of these hormones like what we call catecholamines in certain people, and things like that. There are a few medical conditions that can raise the blood pressure, but the population is very small, about 10% of the hypertensive patients.
Thank you. And can you also talk to us specifically about the relationship between stress and blood pressure? Can you elaborate on that aspect?
Right. So there's a very interesting question. When we are under stressful situations, for example, patients come to our office, and when the nurse checks the blood pressure, or when I check the blood pressure, first response is they're anxious. They don't know what the blood pressure is going to be, so they're worried about it. That leads to elevated blood pressure. It's we call it white coat hypertension. So they come to the office, blood pressure goes up. So how it happens is, all of us, we face these situations in our daily life. Our blood pressure goes up, we are under stress. Blood pressure goes up, it comes down. That's a kind of body's response. So the body makes, what we call catecholamines. For example, epinephrine, which is like a flight and fight hormone. That hormone level goes up, and the cortisol level goes up. Right? These changes in the hormone levels makes our heart rate to go up, our cardiac output, the blood flowing out of the heart goes up. These two add together makes our blood pressure to go up. And the third thing is the vascular tone. The blood vessels become constricted. These three things happen. So stress can, make our blood pressure to go up. But it is our ability to bring the blood pressure back to normal levels is what determines when somebody is prone to have blood pressure from the hypertension from this stress.
So thank you for explaining that. And from what the understanding I get is, it can shoot up, but we have the ability to
Right.
manage it. Um, okay, thank you. What indications would I get if I have increased blood pressure? You know, and on the same note, um, you mentioned about the problems it can lead to, or what we call as complications.
Right.
Maybe you can mention a few of those as well. You know, apart from what we call as the symptoms or some indications and signs we get when we have increased blood pressure.
So the blood pressure usually, this is very common in medical literature is to say blood pressure is a silent killer. It doesn't announce that it is there until, unfortunately, God forbid, if somebody had a complication, we may recognize that when somebody already had a complication, like a stroke or a heart attack or something like that. So as it is, it can be silent in majority of the cases, majority of the patients. But some people can have, my heart is fluttering, flushing of the face, dizziness. But we cannot go by just by those things, because these things can happen in other conditions also. Some people say headache, people can have chest pain, shortness of breath. That is like, if the blood pressure is at a dangerously higher levels or consistently higher levels. So so that's why it's important for us to measure the blood pressure, especially above 50, at least get it checked at least once a year and maybe every 6 months. So the best way to know whether somebody had blood pressure is to measure it. Use the proper size equipment and measure it. And so the next question is, why is it important? Why are we worried? Somebody has no symptoms, he feels fine, but we want to recommend intervention. The intervention could be something, without medications or with medications. So we commonly face this question. Patients ask us, I'm feeling fine. Why do you want to bring it down? Why do you want to treat? Simply because we want to avoid the complications and what we call end organ damage. So the complications, like, the most dreaded complications are stroke, heart attack, congestive heart failure, enlargement of the heart, those kind of things. People can even have intracranial bleeding, like you see it in your practice. They can just present. The first presentation is with intracranial bleed or a stroke. Patients can present like that, and they can present with an aneurysm, kidney problem. These are the problems that can take a toll on the patient's or individual's health, quality of life, and economic implications also. More importantly, the quality of life suffers. This is such a preventable and easily treatable condition. There are medications, and the individual has to be motivated, follow certain small changes in their lifestyle, and instead of denying it that it is not there, I'm feeling fine. It's better to intervene in these situations.
Mm-hmm. So when you mentioned that it's hard to know, like, are there certain personalities or type of people who are more prone for this?
Right. The excuse me. Let me get a cup of water. When we talk about the personalities, for example, people who are sedentary, not physically active, people who are not compliant with the people who eat too much of salt, right? And those kind of things at a physical level. People don't get enough sleep or quality of sleep. And at an emotional level, people that are there is something called socio-psychological stress. people that are stressed out from, for example, work-related stress, family stress, not having good relationships in the family, not having a good social connectedness, feeling insecure. Those are the people that can, these are the areas of research, the areas of interest for medical community. And the evidence is coming out slowly that these people can develop this chronic stress, repeated stress can lead to hypertension. It can lead to high blood pressure. And there are some small interventions you can do. And would you like me to address them now, or you want me to?
We can, I was actually going to come to that next topic, so maybe you can address it at that time. Since we are leading up to it, I could ask that question now in terms of, we talked about the cutoff levels for increased blood pressure, and you beautifully mentioned like what is that stage 1 and stage 2 increased blood pressure or hypertension. My question is, which I get asked quite a lot by people as well, is like, what are the treatment options for increased blood pressure? And specifically what people want to know is like, does everybody need to be treated? And like you mentioned also, your patients, you would have gone through this, like, why do I need to get treated? And at what stage would you say someone needs to be treated with medication? And what stage there are options other than medication?
Right. If someone comes to our office and they don't have any other risk factors for the heart problem. For example, they don't have any known history of heart disease, cholesterol is okay, diabetes. So so we calculate their risk. And let's say if they are in elevated blood pressure range or in the stage 1, we recommend lifestyle interventions and ask them to closely monitor the blood pressure. So sometimes the best way to monitor the blood pressure is at home if they have the proper cuff and the proper equipment. But if they have some other problems like diabetes, known history of heart disease, if they have a kidney problem that already has started, we want to be a little bit aggressive in those patients and keep them on medications. There is since these guidelines have changed, number of people in the world, more than 1 billion people, have abnormal blood pressure, and a significant number of them, they fall under elevated blood pressure range. So those are the people that we can simply change, do few things, simple measures, and prevent further problems for them. Now, for example, the reduction in the salt. If you, for example, in Western population, especially in North America, people intake about 3 to 3.1 grams of salt intake every day. If you bring it down to 2 grams or 1.5 grams, there is a significant change in the number of blood pressure population and people with blood pressure, and there will be a large impact on the healthcare dollars. And for example, if they exercise, we know that the blood pressure comes down. If they lose weight, for a pound of body weight loss, you lose about a millimeter. I mean, you bring your blood pressure down by about 1 millimeter. These are just numbers for motivation. And on top of that, if you have good relationships at home and reduce your stress levels and practice something like meditation, it will help. It will bring your blood pressure down, because blood pressure has, meditation has shown to reduce the blood pressure by about 5 or 6 points on the top number, about 3 points on the bottom number, 2 to 3 points. So meditation can be a very good intervention for these people who are borderline, even when they have high blood pressure. Right? I can tell you in the same context, when people are stressed out, the blood pressure goes up, which is a normal response for the body, and it is our ability to bring it down, and how the body reacts to this elevated blood pressure and stress and elevated blood pressure. So people who are under chronic stress, their response to come back to the normal blood pressure that was pre-stress level is delayed. They take a longer time to go back to the normal level. People who meditate, their levels, get better more quicker. And there is something called rumination. People, kind of ruminate about negative thoughts. Rumination can, make the blood pressure to go up. That's a very big area of interest. These unproductive, negative thoughts, negative mood, leading to high blood pressure. So the best way to handle that is to distract oneself from this rumination. So, there is some literature. They have tried few things, like, for example, stress, coping with the stress training, and progressive muscle relaxation or biofeedback and meditation. When you try these four things, meditation works better in these situations for distracting from rumination and for bringing the blood pressure down.
It's very interesting. And the benefits from what you're saying is significant if you're reducing it by several points. And also meditation helps one as a very good supportive mechanism as well.
Right.
Is that my understanding? Yes.
Right. So the small, let's say you don't have to exercise for 2 hours a day. Let's say, do the walking or whatever you like, 30 minutes a day, and cut back the salt by about 1 gram a day, and meditate for 20 to 30 minutes. See how much benefit we get.
That's wonderful. Yeah. And particularly for people who may not be able to do exercise for a long time, this may be a very good way of compensating for that.
Right. So going back to this, our present crisis, people are, sedentary, people are staying home, maybe not very adherent to the diet, and they are, they may not be able to, some of them may not be able to access the medications because they can't go out and get the medicines. And many of these pharmacies in this country are delivering the medicines to the home. So these are the problems. So if just at home, we need to just pay a little attention to some few things. So like, for example, since you mentioned about exercise, not able to exercise, some of the elderly patients that we see, we recommend them to at least walk 5 to 10 minutes in the morning, afternoon, and in the evening. Like, just you don't have to do all of the walking at one time. Try to be active, just cut back on the salt. And, this stress can lead to, kind of unhealthy behaviors. We need to watch for them, starting from diet, so starting from lack of activity, increased alcohol intake, and things like that. Okay.
Yeah. Well, I was going to ask about the preventative measures, which you already covered quite a bit of it. If I don't have increased blood pressure and not known to have increased blood pressure, and what can I do to prevent those? Is there anything else you want to talk about other than what you've already mentioned?
Basically those are the main things. Lead a good, the moderation in the diet, exercise, having good social connectedness, having good personal relationships at home, and just keep an eye on the blood pressure, keep checking it. By the way, just, somebody who monitors the blood pressure at home regularly, just by doing that, they are able to bring their blood pressure by about 7 or 8 points. So those are the individuals, they measure it, they probably take good care of themselves. Once they start measuring, just by measuring, you can bring it down by about 5 or 6, 6 or 7 points.
So be proactive in monitoring it.
Right, proactive in monitoring, and these are the things. So we can prevent the blood pressure even if it is high. You follow these certain small simple lifestyle changes, we can reduce the requirement of the dosage of medications or the number of medications, because blood pressure can be a progressive disease. It can go from, when we treat them, it may take 1 or 2 or 3 medications, 4 medications to bring the blood pressure down. And in addition to that, if we do the lifestyle changes, we may not need as much medicine in certain cases.
Okay. And suppose if I already have increased blood pressure, and particularly in these times of isolation, how do I manage that? But the isolation is already adding stress to me.
Right. So if you have, if somebody has an access to blood pressure monitor, check the blood pressure once, 2 or 3 readings, 3 measurements, and then again in the evening. And if it is high, contact your healthcare provider, and just make sure that they take the medications, follow those things that we have already discussed: physical activity, watching the diet, getting enough sleep. They don't get stressed out, and if there is any stress, start doing some things. Keep yourself busy, keep yourself occupied. Start a new project at home. You have some, go to the yard, do some yard work, take a long walk, enjoy the music. Talk to your loved ones. If you can't see them personally, call them on the video phone calls. Don't watch too much of news. Don't watch too much of negative things. Don't watch horror movies. Watch some hilarious movies. Make yourself laugh, right? So laughter is the best medicine. So laughter is so contagious. So laughter helps us in so many ways, right? So it can increase our, the happy hormones in the body, happy chemicals in the body, like the dopamine and things like that. Sure. And it is good for the heart, good for the blood pressure, and practice something like yoga at home, and meditation. If you don't know how to meditate, learn how to meditate. There are so many nice meditation apps available. So a number of my patients, we do recommend them to practice meditation, and they find it very useful.
And during one of our conversation, you mentioned that you recommend something like this left nostril breathing for people with blood pressure.
Right.
Could you talk about that as well?
Right. So in our practice, we have a huge number of hypertension, high blood pressure patients, and some of them, for various reasons, they walk into the office, and their blood pressure is sometimes we see something like 220 on the top number, 180, 220 even, we have seen that. And what we have observed, when we make them sit down and make them relax, go through this relaxation of the body, followed by left nostril breathing. So guided relaxation, the left nostril breathing, where we guide the individual to breathe through the left nostril about 9 or 10 times. When they do that, we see a good response. Their anxiety level gets better. Their blood pressure levels get better. Some of them, even we were able to bring them below 160, so that we can avoid a hospitalization for them. We had a fairly decent success with that. But again, try it with, try it under doctor's guidance and supervision. If the pressure is so high, seek the medical advice. And if the doctor is familiar with this, they can try these kind of techniques.
Right. And how often do you recommend doing that? So is it something they do it at home and they start?
Right. So whenever we feel, the stress. For example, this morning I have to do this. So, I had a little bit of stress. So, just I sat down, relaxed, closed my eyes, and feel that stillness within, and did some little bit of deep breathing slowly, rhythmic, slow, deep breathing. That helped me to relax. So anybody can do it, anytime, especially when we face these stressful situations. We don't want this stress to hang on with us for too long. We want to distract from that. And this technique will help us. And I think this is one of the best techniques that we can use to break that rumination and to distract from the rumination and the stress. So left nostril breathing, and we can even do something like some other even the meditation. So when I notice people, when they do the left nostril breathing, they just go spontaneously into relaxation phase.
Interesting.
They just feel that peace and quietness and stillness within, and then they relax. We are not saying that this is a fix for the whole thing, but at least temporarily it can bring the person's, the anger or stress or whatever, it will bring it down.
Relax your body and mind. Close your right nostril with your right thumb. Slowly inhale through your left nostril, breathing deep into your abdomen, and exhale through your left nostril. Smile while you breathe. Repeat this 9 more times.
You can find that video on YouTube or Facebook channel of Heartfulness, and the title is Letting Go of Anxiety. And it's about left nostril breathing, which brings our our rest and digest, which activates a rest and digest pathway, or what we call as parasympathetic pathway. It's a very simple technique which Dr. Koneru talked about, and you can access that resource from the Heartfulness channel. And thank you for mentioning that, and the enormous benefit such a simple procedure like that can bring about, Chandra.
See, Arvind, one surprising thing is, to me, this is a gift to the world. This left nostril breathing. There are some studies that support our approach here, and number of patients, when we advise them, they really enjoy doing that. They feel such a quiet and peace within themselves within few minutes, maybe 2 minutes, 3 minutes. So this is, I would say, gift to the world by India,
by the yogis, and
right,
and clearly highlighted by our global guide recently as well.
right.
So again, it seems to be a very simple technique which anybody can use at any time, and whether you have increased blood pressure or not, you can, like you said, before somebody goes to a meeting, and you're stressed out, and before somebody does something which you anticipate having a problem, or if I'm a student, before going into an exam, I could try and calm myself down, right?
Exactly. That's a very, very nice, good technique. And it helps us to, kind of center ourselves, maintain a state of kind of, some poise. So it's a good technique, and number of, as I said, the number of my patients have benefited from that.
On that note, just slightly, lead you to a little bit different topic, because this has come up and it's in focus right now as well, particularly since the World Hypertension Day has come up. Does people who have increased blood pressure, are they more prone to have a coronavirus infection?
Yes, there is some data to say that, but we don't know the exact mechanism. But the one of the thinking is, people with high blood pressure, they already have some comorbid conditions. They have, they may have heart disease, they may have congestive heart failure, they may have narrowing of the arteries. So that's why it's important to treat the blood pressure at an earlier stage. So if they already have these complications and they are at high risk for infection, they are at high risk for complication from any infection, especially in coronavirus infection. Yes, there is an observation that people are looking into it. The medical community is looking into it. So the coronavirus enters the cells through a receptor called ACE2 receptor, angiotensin converting enzyme 2 receptor. So that receptor is it's part of the, these receptors are part of the angiotensin renin system that controls that is involved in blood pressure. So that's an area of interest for the scientific community. But if somebody has high blood pressure, and if they are staying home, if they are avoiding the contacts and risk of exposure, I think they'll be okay. They don't need to be worried about it. But if but they have to be cautious. They have to take all the precautions like anybody else, or a little bit more than anybody else.
Okay, thank you for reassuring in that aspect, and not to panic. Basically, we take all the precautions. It's almost time now, so I just want to leave with this particular question, because you've given us so many valuable pointers, and you've had vast experience in treating patients with various ailments, and you've seen some, in the form of a SARS previous epidemic as well. Maybe share some of your, in closing, can share some of your insights that have occurred to you during this time of social distancing as well as a medical person on taking care of our well-being.
Right. The one thing that we are very much encouraged by the response by the individuals, right, at individual level, as a community, as a nation, any nation we take. There is so much of people who have demonstrated so much courage, so much strength in these difficult times. This morning, I read a news article from India. There are some migrant workers. They don't have any food or any resources to stay where they are. So they are walking by foot from one state to the other state. And people are, setting up temporary, kind of places where they can be offered food. They are treating them very nicely. So this is bringing the humanity from ourselves. This crisis is bringing the humanity. And so these, we have seen, some of these infections before in our lifetime. The SARS infection, Middle Eastern infection, MERS infection. They were not of this proportion, but they came and they're almost gone now. And this Ebola, incident was there. So this is a much bigger problem this time, but we will come out of this. There will be a vaccine. There will be a medication. It's a matter of time. It may take 6 months to a year. We got to be cautious. We have to maintain social distancing at least. and we'll overcome this. We want to be very optimistic, very positive about this. And this being optimistic will keep us strong. Our immune systems become strong. They stay strong. So I think there is a good hope that we'll find either a treatment or a vaccine or both in the near future. And just to use, the one thing as a physician, what I noticed is, in the last couple of months, our approaches have totally changed. Before, we used to think, as many of us, what is for me in this, even treating the patients. But now it's not that. It is how to protect the patients, how to protect the individuals. Some of our patients want to come to the office. We recommend them, please do not come, stay home. We'll do whatever we can when you are at home. So the whole focus has shifted from me to them. And I have seen that in many, many physicians and many, many healthcare providers. So there is some positivity in this whole thing. So, let's stay positive, be optimistic, use our time, and keep meditating.
Well, thank you. Thanks for being with us today, and thank you to Heartfulness Wellness webinar to put together this nice topic and provide us with valuable insights. And thank you for Chandra for providing us with these valuable pointers and insights. And thank you. Please go and subscribe to Heartfulness Wellness webinars, which has covered so many interesting topics and bringing up quite a few new topics as well. Thank you.
Thank you, Aravind. Thank you from the Heartfulness team for having me here. Hope to see you again.